I'm so glad that you could join us today. Thank you so much for being here today for our webinar. I'm Sangeeta Chatterjee, and I am the Research Director at SVRI. We have an exciting session ahead of us today in this webinar, where we will share findings of our systematic review on school-based interventions to prevent gender-based violence in low and middle-income countries. Before we formally begin, I have a request. Webinars are always more engaging when we know who else is in the room. So let's start building a little community together. Please take a moment to introduce yourself in the chat, maybe share your name, where you're joining from, and maybe a quick note about what brought you here today, what sparked your interest in school-based interventions for GBV prevention. Thank you. And I'm now going to hand over to Sarah to open the webinar. So Sarah manages the Southern African Development Community Regional Component for the Partnerships for Prevention of Gender-Based Violence in Southern Africa, which is a program implemented by GIZ on behalf of the German government. Based in Gabon, she works closely with the SADC Secretariat's Gender Unit to strengthen regional structures for GBV prevention. Sarah has worked with GIZ since 2017 in regional and global programs with thematic expertise in women's empowerment and skill development. So over to you, Sarah, to lead us into this webinar.
Good afternoon. Thank you so much, Sangeeta, and thank you so much to everyone for joining us. It's a real pleasure to welcome you today to this webinar hosted in partnership by our program, as mentioned, the Partnerships for Prevention of Gender-Based Violence in Southern Africa, short PFP, because we know it's quite a mouthful, and our long-standing collaborators at the Sexual Violence Research Initiative, SVRI. Sangeeta just gave a great summary, but for those who maybe are less familiar with our work, PFP is a regional program implemented by GIZ on behalf of the German government, and PFP works to prevent GBV by tackling its root causes, strengthening multi-stakeholder partnerships, and supporting innovative, locally adapted prevention initiatives in Lesotho, Namibia, South Africa, Zambia, and Zimbabwe. Examples of these numerous flagship initiatives include, for example, working with religious and traditional leaders to revise bylaws that help end harmful practices, and also empowering teachers, parents, and learners in raising champions to fight GBV in their schools and communities. Our regional SADC component, based here in Gaborone, Botswana, works closely with the SADC gender units. SADC, by the way, for those who maybe are not familiar, refers to the Southern African Development Community. Here, PFP focuses on strengthening regional structures, systems, and knowledge to advance GBV prevention. A core part of that work is supporting the production and use of high-quality evidence, not just for the sake of research, but to shift policy, guide programming, and ultimately to make prevention more effective on the ground. And this is exactly why our partnership with SVRI matters so deeply. Together, we've been investing in stronger research ecosystems in the region, from supporting regional researchers to launching new research initiatives to generating evidence products such as the one we're launching today. And we are especially proud to be doing this during the 16 days of activism against GBV, a moment where the world's attention turns to the urgency of prevention and where evidence is needed most to drive the change that we actually talk about. Today's session marks an important milestone, the launch of this evidence gap map on school-based GBV prevention programs led by Stellenbosch University. Schools are spaces where gender norms are shaped every single day, for better or for worse. They are also one of the most powerful entry points we have to prevent violence early, consistently, and at scale. Until now, however, we haven't had a consolidated picture of what interventions exist, where the evidence is strongest, and where the gaps still hold us back. This new gap map brings together findings from over 50 studies across 50 countries, including, which I'm very happy about, 15 in Southern Africa. It helps us see what we know, what we think we know, and where we urgently need more focus, especially in our region. So I'm extremely excited for today's discussion. I want to thank the colleagues from Stellenbosch University for their leadership, especially the panelists who are here today, for sharing their insights on how we can move from evidence to action, not just globally, but also specifically in SADC member states where effective prevention is most needed. So thank you again. And with that, let me hand back over to Sangeeta.
Thank you so much, Sarah, for that lovely introduction. And now I am going to hand over to the research team from Stellenbosch University. So the research team today, there are three presenters. Professor Sarah Skeen is a professor in global health at Stellenbosch University, where she is also co-director of the Institute for Life Course Health Research, as well as chief specialist scientist at the South Africa Medical Research Council. Sarah focuses on developing and evaluating programs to reduce risks for and strengthen child and adolescent mental and physical health and development, as well as maternal and caregiver mental health in contexts of adversity. She also has a special interest in gender and gender transformative programming. She will be joined by Dr. Cassandra Carrolls, who is an early career researcher with focus on developing and evaluating school-based intervention programs in low-resource settings. She has experience in participatory research methods, mixed methods, and social psychology. She has collaborated with and worked with various stakeholders in low-income communities within the nonprofit and education sector to lead school-based psychosocial interventions through sports. She has also served as the chairperson of the school governing body at a local primary school. And lastly, Kelly Gemmell will also be joining us. Kelly is a public health nutrition practitioner and researcher with 14 years experience working in this field. As a community-based dietitian working for the South African Department of Health, she gained an awareness of how the complementary aspects of nurturing care and enabling environments are needed to realize optimal early childhood development in low resource settings. With her research career, she is keen to bridge the gap between what evidence based research tells us about optimal early childhood development and how it can be applied in the health system's strengthening sphere. And so, without further delay, I'll hand over to our fantastic team of researchers to share the findings from their systematic review. Thank you.
Thank you so much, Sangeeta, and hello, everybody from a very warm Cape Town today. I just want to briefly say hello and say thank you to everyone to SVRI and GIZ for the opportunity to conduct this gap map. We are from a group at Stellenbosch University called the Institute for Life Course Health Research. And if you're not familiar with us, we conduct research and we synthesize evidence on interventions to improve child and adolescent outcomes. From actually across the life course, from the preconception period through to adulthood. Although there are only 3 names on the slide, there's a very large team behind this work. So I just wanted to acknowledge their contribution before we move forward. And also last of all to say that we are always looking to connect with researchers with similar interests to us, particularly from other countries, other low middle income countries. So please do connect with us after the webinar if we have any overlapping interests. We'd love to make new friends. I'm also very happy to see some old friends actually in the participants list for this webinar. Nice to see everybody here. I'm going to pass over to Kelly to start us off.
Thanks, Sarah. And thank you to everyone for the very warm introduction and welcome. So with my, you can move to the next slide. Thanks, Cass. So with my slides, just to say the next couple of ones, I will be presenting a little bit of background and then also the brief methodology to the systematic review that informed the evidence gap map that we will be sharing and with you later on. So with that, to start, a little bit of background. As we all know, violence against children and adolescents has a devastating impact on their health, with leading to wide-ranging health and social problems, mental health issues, the potential to engage in risky behaviors, and also perpetuating violence itself. So, most violence against children involves 6 main types of interpersonal violence, as you can see in the graphic depicted there, and it can range across the child developmental stages. But when these types of violence are perpetrated or directed against children because of their biological sex or gender identity, we know that this constitutes gender-based violence, or GBV. On the African continent, the African Union's Agenda 2063 recognizes that gender-based violence is a barrier to human security, peace, and development. Cass, you can move on. Thank you. So with that in mind, we know that published in 2019, we have a guide and a resource, an evidence-based resource called Inspire, which provides 7 strategies to support countries and communities to reduce violence against children. The 7 strategies that you see are listed on the right-hand side of my slides, and they provide they are the best available, based on the best available evidence, to help countries and communities intensify their focus on the prevention programs and services. Thanks, Cass. The next slide, please. As Sarah did say, schools are in a unique position, and is an area or a setting where we could have an impact. They're in a unique position to address and prevent GBV, as they can take an active role in engaging on issues related to violence by shaping social and gender norms, influencing children's and youth's lives, and preparing them for adulthood. However, on the other hand, we also know that schools are not necessarily made up of a homogeneous group of people, and any program and working relationship really needs to take in that specific context in mind, that local setting in mind, as they move forward with any of the interventions and programs that they provide or wish to enact. Thanks, Cass. So with that in mind, with bearing all of that in mind, what was the purpose and aim of our project to develop an evidence gap map? It really was to highlight the existing knowledge and identify areas for future research related to school-based programs for GBV prevention, with the aim to strengthen evidence-based policy making around this topic within the South African development community. Thanks, Cass. So just to give you a bit of a background as to what an evidence gap map is, or sometimes we refer to it as an EGM or shorten it to an EGM, it's a systematic evidence synthesis product that collates and depicts the available evidence for a specific research question. How does it do that, or what is the methodology that one uses? I'm going to go into what we did in the next couple of slides, but it follows a systematic process. And at the end, our aim was really to develop a tool to support decision makers to make a more informed, evidence-based choices about research, program design, and then future investment in schools-based violence prevention. Thanks, Cass. So I'm just going to stay on this slide for a little bit, just to provide the brief methodology of how we went about developing the evidence gap map. It, as you can see, was a multi-step process, and we used systematic, following initial conceptualization and literature review period that we undertook with SBRI. We actually entered into what is called interest holder engagements in this space, and we did this to enhance the systematic review methodology that we were to undergo next. So here, or during this phase, we really approached 8 individuals and experts in the field of GBV who represented civil society organizations, government, provincial government, and so on, policymakers, to undergo or undertake individual intervention and interviews with them, as well as conducted a single group discussion with 10 adolescents between the ages of 12 to 16 years. They were recruited from an area in Cape Town called Khayelitsha, where we work frequently, and it is characterized by high adversity and also low socioeconomic circumstances. And what this interest holder engagement, they told us, is really, it kind of helped us to refine what we had found out through our evidence review, or literature review rather, but really helped us to define and refine our search strategy, and then also to the review parameters, the PICOs, and the interventions that we were going to characterize within the evidence gap map, which was incredibly helpful. We also did go back to the experts at other stages, which I can go into. But following that initial interest holder engagement process, we moved on to our systematic review. And just in the essence of time, because we don't have too much, we can always take your questions about it afterwards, but we conducted systematic searches on various databases and supplemented these with snowballing and citation tracking, and then finalized with our finalized PICOs, review parameters, and following our protocol registration, we embarked on our searches and our screening, our extraction process, which we did in EpiReviewer, which Cass will go into with a little bit more detail. But in terms of and then we performed quality appraisal using on the studies, following the extraction process and the screening process using the Joanna Briggs Institute critical appraisal checklists. And following this, we developed the evidence gap map design, developed this using a standard intervention outcome matrix, which was also constituted with various dimensions, or what we can call filters, to help refine the evidence gap map and the findings, really. You can go on to the next slide. Thanks, Cass. So please. Thanks. So this is a bit of a busy slide, but just to give you a bit more background to the scope of the evidence gap map, we included systematic reviews, randomized control trials, quasi-experimental studies conducted in low and middle income countries, the year 2000 onwards, and published in any language. The population that we were looking at were children and adolescents aged 5 to 18 years, and the interventions were based on those 7 strategies of the INSPIRE framework. So they were school-based or school-linked interventions that sought to prevent child and adolescent GBV exposure and victimization, and improve knowledge and attitudes about GBV, help seeking, and other relevant behaviors and skills in these groups. The comparison we included studies with control or comparison groups receiving no intervention, standard practice or care, or alternative interventions, and the outcomes parameter really sought to look at GBV exposure and perpetration, GBV-related knowledge and attitudes, help seeking, supportive behaviors, as well as healthy relationship skills. So with that, I'm going to hand over to Cass to get into the results and the findings. Thank you very much.
Thank you so much, Kelly. Just navigating around here. And so just looking at the results of the study, as Kelly said, that we conducted a systematic review. Everything was done in EpiReviewer. After screening, after all duplicates was removed, we screened about 11,901 studies, and then we went through our title and abstract screening. We also went through our full text screening. And then the final, we included 57 studies that was included in the review, 25 of which was RCTs, 25 was quasi-experimental studies, and 7 was systematic reviews. Based on the appraisal tool that we used, 36 of the primary studies, which was the RCTs and the quasi-experimental studies, 36 was rated good to fair, and 14 studies were rated to poor or uncertain. The primary studies were conducted across 50 countries, of which, as mentioned earlier on, 15 was in the SADC region. And this just gives you an overview of where the studies took place. Yeah, and so you can see there's a vast majority that is not being covered, but also within the African continent, there is quite a bit of work that's already being done in this space. If you're looking at the findings in the interventions, 47 of the interventions or 47 of the studies focused on education and life skills, and 26 of the studies focused on norms and values. And then with one study focusing on parent caregiver and income and economic, Sorry, I'm just moving things around here. Income and economic strengthening, and then 4 studies focused on support and response and support services. No studies that we looked at included studies that looked at laws and governance, or that focused on school governance and safe environments. So we found no studies that reported on this. Of the interventions, the beneficiaries of participant interventions, 18 studies included children, and by children we're looking at children between the ages of 6 and 12, and then adolescents would be from 13 to 18 years old. 42 studies included adolescents, 3 studies included or was directed at school staff, and 1 study was focused on parent or caregiver support. The outcomes that was measured was, you can see most of the studies, 39 of the studies focused on GBV-related knowledge and attitudes, while 18 studies focused on GBV exposure. And then the rest of the studies, 10 studies focused on GBV prevention, or perpetration, and 10 studies focused on healthy relationships and skills to prevent GBV. 5 studies focused on GBV-related help seeking, and 5 studies focused on GBV-related supportive behaviors and environments. If you're looking at the setting, 46% of the studies was conducted in high schools, and that would be and we also, the studies, in some studies they did not focus on, we looked at an age bracket as well for to guide in whether we're saying high school or primary school, because in different countries it's referred to as different margins. And so high schools will look at 13 and above, and then primary schools will be between 6 and 12 years old. So 46 of the studies were conducted in high schools, 30% was conducted in primary schools, and 24% looked at both high school and primary school. When we're looking at the aims of the interventions, 62% of the interventions had a primary aim of that was GBV related. So the primary aim was GBV related. Only 10% was the secondary aim was GBV related, and 28% of the studies, they did not have an aim that was directly related to GBV, but they did have they did measure various aspects of GBV, or that fell within the INSPIRE bracket. And if you're looking at the implementers of these studies, a vast majority of the school studies was teachers were implementing, or school staff was implementing these studies. So 24, it's represented by 24 studies. 22 was lay or paraprofessionals, and these was just in terms of definition, the lay, it would be someone that was trained specifically for this intervention, or they didn't have a formal degree. And then 8 was trained professionals, and they were professionals that had a professional degree, such as a nursing degree, social work, psychology, and so forth. 6 of the studies included peer facilitators, while 4 of the studies was unclear. 41 of the 50 primary studies were conducted in person, and 9 was hybrid, so that it had an online component as well. And I will now give over to Seda.
Thanks so much, Cass. So as part of this project, we didn't do any meta-analysis looking at the effectiveness of interventions overall. But what we did want to look at is to try and get an idea of what the effectiveness was, like at almost at a crude level of these different types of interventions and which types of outcomes they were having impact on. So what this diagram shows, we've collapsed together the results that were reported on victimization and perpetration. So let's say the kind of hard outcomes, as it were, and then try to look at, if we look at the different Aspire strategies, which are on the left-hand side, generally speaking, what is the pattern that we can see in terms of whether or not interventions that included these aspects of Inspire reported positive outcomes or improvements, or didn't report any improvements. So giving you an example, if you look at the first one, education and life skills, which as you could see made up kind of half of the interventions that were reporting on these types of outcomes, you can see that there were some interventions that did have any positive victimization or perpetration outcome reported, but actually about 2/3 of them, or even a bit more than 2/3 of them, didn't actually report any improvement on victimization or perpetration if it was just not just it, but if it included an education and life skills component. And then similarly, we actually see a similar pattern for interventions that were included norms and values. There were some that reported positive improvement, but again, it's just more than a third there, whereas the rest didn't actually report improvements on any of these hard outcomes that were related to victimization and perpetration. And then some slightly smaller numbers for the other strategies there. Just as a reminder, we didn't have any studies that measured school governance, that measured any impact of higher level kind of laws or governance change, or the impact of safe environments, of increasing safe environments in schools either. You can go to the next slide. So in this slide, we've collapsed together all the other related outcomes. So this is particularly around help seeking for GBV, supportive behaviors, which we call for GBV, or any kind of GBV related healthy relationship skills that we believe would prevent the prevalence of GBV. And here we can see actually a slightly different pattern, because we have proportionally more positive improvements reported for education and life skills and for norms and values as well. And then we also have a few emerging it's difficult to really draw trends for some of these because there's so few studies, but also some positive impacts of interventions that use parent and caregiver support, income, economic strengthening, and response and support services. So it gives us a little bit of an idea into what kind of effectiveness we're finding, but we're going to, as a next step, do a more deep dive into this and try and do some proper meta-analyses and try and figure out exactly what types of interventions are most effective for which outcomes. Next slide, please. So at this point where we are with what we found through this process, we looked in great detail at some of the recommendations that came out of the papers themselves. And I'm really going to summarize these for you in the next few slides in terms of research, in terms of policy, and in terms of practice. These are the recommendations that came out the most frequently, as well as combined with some of our overall, looking at the overall picture of the body of research, what we have found. So the first is that we really need to start to evaluate interventions that are looking at, particularly, I think, at school governance. So if we're improving school governance, so if we're using tools like policies around gender-based violence, better reporting structures, we're training staff, for example, around how to respond to gender-based violence, those types of interventions are not being evaluated effectively at the moment, or certainly not in a way that we are picking them up through these types of searches. And I think that if we're not going to be looking at that, as well as obviously very importantly, improving the safety of school environments, we really need to start to think about how we can do a better job of evaluating those types of interventions, because at the moment we don't know if they work or not. And we don't know, and of course, what types of interventions within those work as well. We have an issue with study quality, which we can chat about more, but there were some good quality studies, but there's a number of studies that were not very good quality, and I think that's a common problem that we find. And we do want to do more work, as I mentioned, on synthesizing across all of these studies and really looking at the effectiveness across different interventions, but also thinking more closely about how the effective interventions actually work to improve outcomes and how that relates to the context that they are being implemented in and the populations that they're being implemented with. The other thing is, for the most part, the interventions are delivered in high schools, but we don't know much actually about which interventions are most effective at different developmental stages, and we feel like there's a need for more research in that area as well. Next slide, please. What common theme in these papers is the need for multi-sectoral collaboration and programming, and I think we all know that. I mean, even just having within the education sector at all, having this focus on gender-based violence is not always something that happens. So there's a lot of call within the papers for this and to promote this and to really invest in it. And that can look like different things, including integrating GBV into the school curricula. So we can see that it looks like there's an effect on some norms and values and social emotional learning skills on GBV prevention. And more explicitly including GBV related aspects into that is important. The next is that we need to think about the structural drivers as well. So then there are opportunities to link these kinds of programs to economic empowerment programs or nutrition programs. And there's a small amount of studies coming through that have done that. And then, of course, the education workforce. We didn't find many studies that were engaging in training of the workforce. And we think that this is another area that we need to do more on, but that we can learn some lessons from some of the studies that have already been completed. Next slide, please. Of course, this is not new, I think, to any of us, but making sure that the interventions really do fit the context in which they're being delivered. I like to say that every school is its own universe. And I think it's really important that we try to think about that. It's very complicated, of course, but that we try to think about how we can embed these programs into schools, knowing that schools do vary so much and are very diverse in terms of how they manage things, or the populations that go to them, the types of capacity and training the teachers have. We think that there's not enough sharing of best practices and resources. So trying to create more of a system where schools can access guidance, they can access best practice resources and open access resources is really important. And there's a strong feeling in the literature that there's a need for investing more in facilitator support, particularly since this is a sensitive issue and the types of support that are needed might be quite specific for a number of reasons. And then finally, just this idea, which I mentioned before, of trying to think about using methods that are age appropriate and that are engaging for young people. So we found in some instances that some of the content would be used, designed for a different age group and maybe not necessarily appropriate for the age group that it had been delivered with as well. So just making sure that that's something that we consider. And in fact, that's something that I think came up a little bit last week, actually, in how schools were addressing the issue of gender-based violence in light of the Women for Change protests that happened last week. It's certainly conversations that I was involved in last week as well. I think that is all of my slides. I'm going to hand back to Cass, but we would love to actually hear from you. I see we do have some questions already, but please feel free to come forward with your questions. I'm going to move over to the Q&A just for now.
Sorry, so Sarah, I do have them collated. I have 3 here for us, in some that have come from the chat, and then, well, 1 that has come from the chat, and then 2 from the Q&A box itself. So there was 1 from, so I can pose this to the 3 of us, if that's okay. So the first was from Yadana, who shared or asked, are there any studies focusing on self-defense and negotiation skills? So I'm happy to answer this question, if that's okay with the both of you. Being one of the kind of screeners and extractors, I can definitely say yes. I can't tell you exactly, but that self-defense and negotiation skills would have been captured under the education and life skills intervention, which is one of the one of the 7 Inspire pillars or strategies. So Cass, you would also be able to chime in, but I would say yes, that they would be characterized under that particular. And when Cass does take us through the evidence and gap map and how the use of it, you can we can show you how to kind of search for that particular intervention and so on. And then there was a question from Erica around the age and the scope. And so around, not including the early learning program sector of like aged 3 to 6 or 4 to 6. And so I can say that was a no. We didn't include that age group. It really focused on kind of primary school, as Cass shared, primary school and high school going children. I must admit, Sarah, I'm trying to think now why we decided on that, but I'm not sure if you can remember the scope.
Well, I think we were more focused on primary school and secondary school.
Yeah.
And I think that the types of interventions that you would run
Yes.
with that age group would be quite different. And I think we would also have had to think about how to conceptualize them quite differently as well. But it would certainly be something we would be interested in doing. So.
I also would just like to add that in terms of the age group, that most of the studies was in secondary, and that was also the age would be 14 or 13 and up, and that was also lots of these studies was also not looking the primary aim was not GBV related. It was mostly in the primary school area, and this is what we also found from our advisory boards, where they see that most of the interventions was focused on adults as opposed to children, because of, just like Cedar said, there's a different type of intervention and strategy that you'll use when looking at the younger age groups. And so in schools, they were more focused on education and life skills, and I think that also came out in our searches.
Cass, I'm going to pounce this one on you, but there is one in the chat that Tvisha asks, where they ask, did you examine how the results varied based on the specific types of GBV the intervention was focusing on? For example, intimate partner violence, child maltreatment, bullying, etc. So we didn't necessarily pass the various types of GBV out. We did lump them together. I mean, I think that would be an interesting follow-up or follow-on from this study. I'm not sure if you wanted to add anything in, Cass, there.
Cedar, do you want to
Yeah, I can. I mean, basically, we haven't broken down the different types of perpetration or victimization. I think it would be interesting to do that, and it would be obviously depending on the developmental stage as well of a child or adolescent. We would likely find different patterns that emerge. I think part of the reason is that we do hope to do meta-analysis on these results. So we have got sort of 5 big categories really of outcomes, and that's how we categorize them. So we have victimization altogether, perpetration altogether, and then the other 3, which are more the sort of supportive behaviors, help seeking, and healthy relationship skills. And usually when you do a meta-analysis, you do have to do some combining of outcomes to make sure that you have sufficient papers to actually run the analyses. But that said, I think we're really interested in doing deeper dives into these papers, actually. So trying to really look and think about what types of interventions work for which specific types of outcomes, which specific types of violence. And that's certainly something that we will try to move on to next.
Yeah, and I think that also then leads into just the evidence gap map, and what that looks like from a visual perspective is that it gives you an overview of what interventions are being done, and in on what strategies is being focused, as well as what the outcomes outcome focuses are. And so I think a deeper dive would definitely be needed. But for the purpose of the evidence gap map, you'll see once I go through the evidence gap map, how you are able to search for articles that's related to your work. Kelly, I'm not sure if there's any other questions.
There is. There was kind of a comment and question from Helen, who said, I'm concerned about the ethics of taking time away from students at schools with poor academic performance. Where do you take the time from? Academic classes, breaks? It might be more appropriate to influence behaviors of parents, guardians, teachers, nurses, etc., instead of interfering with the school day. I mean, from my own experience of dealing with and kind of grappling with these studies, I would definitely say that, and Cass, you can chime in on this, but they were either the interventions were either they took place in like a life orientation kind of session or time period during the day, or they would actually take place after school. That was my experience. I don't know, Cass, if you had a different one, but I think it's a very real concern. And I think we didn't see enough of that kind of like inter or multi-generational combined intervention. It would rather just be targeting the child or the adolescent or the parent, not necessarily combining the two. I'm not sure, Cass, if you'd like to add any, but it's definitely, noteworthy, your concern.
I can also add something there. I mean, I think I hear the concern, but I think that for the most part, with these types of topics, which are really critical for human development, addressing them within the curriculum of the school is really important. So, for example, in South Africa, we have a class called Life Orientation, which is a kind of a counseling, not counseling, but like a kind of social skill, emotional learning skills lesson, which takes part as part of the school day. And that type of curriculum exists in many different countries, I think almost all countries. So it can be integrated into those classes, but there's also opportunities to integrate it into any class. Within your language lessons, within your math lessons, there's different ways that teachers can integrate some of this messaging. Sometimes it's about actually talking about violence directly. Other times it's about addressing gender equalities or inequalities through the way that classes are run. So I don't think that we should think of it as only being an after-school activity that you join, which is a group which takes place at a very awkward time. It's not only that, we're really trying to show that these interventions can take lots of different forms. And things like creating a safer environment in schools, looking at the way schools are governed, these are all important ways of intervening and preventing gender-based violence in a school-based setting.
Sangeeta, I'm not sure if you'd like to just give us an indication of time. I see that there are more questions, but I'm just wondering if we should move on to the next section and I can potentially try and address them via message or text, the ones that are still outstanding, and then just not take away any more time from the evidence gap map itself. And some of these questions actually might be addressed there.
Sure. Definitely. That sounds like a good plan. We can definitely move on to the demo. Thanks, Kelly.
Pleasure. Thanks.
Thank you so much. And I think some of these questions, just technologies, here we go. So this is what the overall gap map, evidence gap map looks like. I will go into a bit of detail of how to navigate around the evidence gap map. But again, some of these questions will come up in terms of where research is not being done and where research can be done and interventions can be done. This is a nice view, a nice visual representation of what we just spoke about in terms of the systematic review, where there are gaps, where studies are currently being done, how many studies we found in each of those. Yeah, and so this is and this can be utilized for both researchers as well as implementation staff or implementation organizations that do the interventions within the in the respective settings. So we spoke a lot about EP Reviewer. And so this is one, here you can see that we did everything in EP Reviewer. All of our screening on title and abstract full text was done in EP Reviewer, and then we coded on the evidence gap mapping tool. And this included the various intervention strategies, the outcomes that we looked at. We looked at different other filters that you'll see in the evidence gap map, such as the year, the country, the intervention modality, all the findings that we just spoke about that I did earlier on. This was part of our evidence gap mapping tool to then create the evidence gap map. A JSON report was then drawn, and then we shifted we put the JSON report within EP Mapper to then draw the evidence gap map. And so now I'm just hoping, just changing my screen view in show. And so then this is what the evidence gap map then looks like. You can see that that on the left-hand side, you have your interventions, and the interventions we spoke about are the INSPIRE strategies, and you can see that they are all clearly represented there. And then the outcomes that was measured, also we looked at, that we also spoke about in our results section, is on the top axis. If you hover over each of the cells, you'll get a definition of what that included. So when you're looking at the evidence gap map, you'll see a definition of what GBV exposure looked at, what GBV prevention perpetration looked at, as well as what the intervention or the different strategies include. And that's just giving you the overview of how we looked at the results. The studies we looked at, so represented in each of the cells, you'll see that the studies is represented based on the type of study that was included. So either RCT, a quasi-experimental design, or a systematic review. If you hover over one of the cells, you'll see studies that looked at, or the intervention was focusing on norms and values, and looked at the outcomes of GBV-related knowledge and attitudes. There was 12 RCTs, 10 quasi-experimental designs, and 4 systematic reviews. And so this shows you all of the studies that were included. If you look at the top of the evidence gap map, you'll see how much studies was included, the 57, as I mentioned in the results section. If you do click onto the cell, you'll see, just move this down, you'll see there are 26 records in this in that cell, and you can also then group them by segment. So when you're grouping them by segment, this basically means you're grouping them by your different study design. So all your RCTs will then be on top. It will be then followed by your quasi-experimental designs, and then your systematic reviews. And this is how you can see, then you will see each of the studies that was included, and you'll get an overview of what that study then looks like, and you are able to then download the full text or cite the full article. And so that's just an overview. You can dive a bit deeper into this if you go into the filters. I will just go, if you scroll down and you scroll by country, since we are South African, us as the researchers, you can just go by country. I'll use South Africa as an example. You can then update this, and then you'll see all the interventions that is currently being done, or all the studies that focused on GBV prevention within schools that has been done in South Africa. So here you can see there's a big focus on norms and values across all of the outcomes, with one outcome not being included. So definitely there's a gap in the research base. Just looking at this evidence gap map, you'll see on school governance, as mentioned, none of the studies focused on school governance. Excuse me, none of the studies focus on school governance. As we mentioned, none of the primary studies, so that was the RCTs and the quasi-experimental designs, none of the primary studies focused on governance and laws. However, 2 systematic reviews did focus on governance and laws, and then you can just have a deep dive into, again, you do the same principle, you click on that, and you can see what the study says about school governance. But for the vast majority, no studies was included. And then just looking at the size of the circle, the size of the circle is just it just gives you an overview of the bigger the circle, the more studies for that particular study design. And then all of our So you can also then look at filtering by children, for example. If you update, it will then show you all the studies. And here you can see your total view of your records. There's only 3 studies that focused on children in South Africa, but this is where the focus is. And so children, again, is aged 6 to 12 years old, and that's in your primary school. And so here you can clearly see where the gaps are in the research or in the interventions. So for example, if you are someone that is doing interventions, you can see where interventions are required, but also if you're wanting to strengthen your intervention that you're currently doing, there are studies that you can look at to getting what the research says about those studies. Yeah, and so all of the findings that we reported on, all of the studies that we reported on, you can then also filter by, you can filter by quality, you can filter by intervention setting, and so forth. I will just unclick this. Yeah, and so if you're looking at based on all the records, the 57 studies that were included, here you can, again, a snapshot of all the interventions that, or where there are gaps in the research. And you can see some where the dots are smaller. That means there's only one study that focuses on that, which means that is also an area of concern or area that needs to be explored within the research. And if you're wanting to then just play around with just the features in the evidence gap map, you can look at it in different views as well, depending on your preference and how you like to view. But for the purpose of this, we'll just stick to this design. Yeah.
Thank you, Cassandra. Wondering if we can now take some questions. If anyone has any questions about the gap map, if you could just post it in the Q&A section at the bottom of the screen, and then Cassandra and the rest of the research team can answer any questions you have. And apologies, we know that the website isn't working, so the link to the gap map isn't working very well. Apologies for that, but hopefully you have a sense of how the gap map looks, and it'll soon be working properly, hopefully by tomorrow.
While we wait for any new questions, I can just address the last question that hasn't been answered so far. Someone asked, children with disabilities in low and middle income countries are at higher risk of school-based GBV due to exclusion and limited support systems. How can inclusive education frameworks be strengthened so that GBV prevention programs become disability sensitive and ensure accessible reporting, protection, and psychosocial support for all learners? And basically, we would have included, just to say, any studies, that did include children with disabilities, adolescents with disabilities. I don't think we actually found any. I might be wrong, and Cass, please also just correct me if I'm wrong there, but I don't remember any in the data set. So I think this is a really interesting and neglected area that we need to be looking at more closely. Just from other work, similar work, I think it's really important that we take a kind of two-prong approach to this. So from the education side, we need to ensure that when we do design GBV prevention strategies for schools, that we're thinking about disability at every stage, whether it be in the kind of primary prevention stage or all the way through to treatment and support, all the way through the different types of inspire strategies that we mentioned. So thinking about the policies, how do we integrate disability? Thinking about safe environments, what does that mean for disability? Thinking about parental, like reaching out to parents and programs that include parents, what does that mean for parents of children with disabilities? What does that mean for parents who have disabilities? So we really need to think of it from all the way across. At the same time, we really need to engage the disability community as well. We need to be speaking to people with disabilities, young people with disabilities, and getting their views on how we should be doing a lot of that, and making sure that the issues of gender-based violence are also coming up within the disability community as well. So really trying to kind of balance both of those sides. And there's obviously a lot more awareness raising that needs to be done. I think it has improved in recent years. I think people talk about gender-based violence for women with disabilities, for example. I'm not sure that there's much discussion about it for young people and for children. So I think, yeah, I really think it's a very big gap and something that we need to focus on a little bit more. I'm not sure if there are more questions. Yeah.
There was one question related to if we characterized according to gender, so GBV, and then characterizing specifically to male, female, etc. But I remember we did come across, we didn't necessarily characterize within the evidence gap map necessarily, but we did come across and included, the not GBV, just violence constituted against like women or females, but also males. So there would definitely be there. But Cass, I'm not sure if there's anything else to add. But yeah.
Yeah, so I think we didn't we didn't not include or didn't specify gender. We included all studies within high school and primary school that focused on GBV, and studies did include either the entire grade or spanning across various grades. Some studies did focus on just male or female. We didn't make that exclusion here, but we also so we didn't make that the difference because most of the maybe Cedar, you can also answer that, but I think in terms of the studies as well, there was no exclusion of male or female unless it was a targeted approach. Really, not many of the studies was targeted. Most of the studies was universal, so they did include both male and female within the studies. So if you scroll or if you look at the filters, you can go to the targeted, and those will be the ones that were specifically targeted either male or female, but they would specify what that was.
Yeah, I think you covered it, Cass, but I think just to add, we would be interested in looking at that more, obviously, once we do a deeper dive into these studies, thinking about the different types of violence and the different populations affected, to try and look at differences, basically, or what findings we'll obviously keeping in mind that we know that most gender-based violence is experienced by women. But we'd be interested to look at different patterns or trends that might come out of our data.
Yeah. And I think also just to note that all of the studies was preventative interventions. And so not intervention where it has already been perpetrated
Thank you. Thank you so much for answering all those questions and sharing the findings of your research with us. I think there are no more questions. And again, apologies for the issues that you're experiencing with our website. We definitely share the link to the recording of today's webinar, as well as the link to the evidence gap map and the research brief that sort of has all of these interesting results with all of you, and then you can hopefully engage with it. And thank you so much for joining us today and for engaging with the findings of the systematic review on school-based interventions to prevent gender-based violence. I hope that the review for you has highlighted both the progress that has been made as well as the critical gaps that remain. We now definitely have clearer evidence on which approaches show promise in shifting attitudes, building safer school environments, and empowering young people. At the same time, we have seen where the research is thin and where innovation is urgently needed. And what this means for all of us is that our work is far from finished. Schools are not the only places of learning. There are communities where norms are shaped and where prevention can take place from an early point to prevent gender-based violence across the life course. And I encourage you to take these insights forward. And I hope we can all come together and collaborate as a community to challenge harmful norms and to design interventions that can truly make a difference to prevent gender-based violence. On behalf of our team, I want to thank you for your time and for your commitment to this important issue. Thank you, and we look forward to continuing this journey with all of you. Bye. Thank you.